Airway clearance is important for people who have CF because it is the most effective and efficient way to clear mucus out of your lungs. By having a designated 15 to 30 minutes session, you can get that mucus loosened up and move it out of your lungs so that you can feel good and breathe easier. Most people with CF will also be prescribed inhaled therapies to do in addition to the airway clearance. The order that you do things in is important. If you have a bronchodilator, that should be done first to open up the airways. Next comes hypertonic saline. After that, after you've thinned and loosened up that thick, sticky mucus, the airway clearance should be done to move it out of the lungs. After that, the last thing you should do, if prescribed, is an inhaled antibiotic. If you have any additional therapies or you have any questions about this order for you or for your child, please be sure to talk with your care team the next time you're in clinic. A common airway clearance technique for people with CF is high-frequency chest wall oscillation, commonly referred to as the vest, the encourage system, or the smart vest. This type of treatment should always be an active treatment. And by active, I mean you shouldn't just sit there and let the vest do the work. You really should be taking some deep breaths intermittently during the session. Additionally, you should be pausing every so often to clear the mucus out by doing a few huffs and coughing. An important piece to any airway clearance technique is the huff. However, some people don't like to huff. A common excuse that I hear for avoiding the huff is that it makes me cough. I don't want to do it. But that's the point. You need to cough to get the mucus out. And by doing a huff, that cough can be more effective and more efficient. Every time you huff, you're going to move the mucus up closer to the larger airways where you can then cough it out. However, it shouldn't be uncomfortable. What I love about the huff when I talk with people who have CF is that I often get to tell them they don't have to do so much. They can back off a little bit, and that's something we don't often hear in CF. We tend to always add more things to your routine. What can help with huffing is using a tube or the back end to the acapella mouthpiece. By using a tube, it can help to keep your mouth in the perfect position that it needs to be in to keep your airways open to allow the air to flow out. You should never hear extra noises, any wheezing or harsh noises, because that's a sign that you're working a little bit too hard to do that huff. Not everyone brings up mucus each time they do airway clearance. That can be a good thing. Maybe your lungs are really functioning well and you don't have a lot of mucus to bring up. That doesn't mean you can stop doing your airway clearance or that you can leave out the huff portion of it, because there may be stuff that gets loosened up with the vest or the acapella or whatever airway clearance technique you're doing, and it's going to sit in those small airways and it's not going to get up high enough to clear out without the huff. So it's very important that even if you're not coughing anything up, you're still doing that huff so that you're getting that clean sweep of the lungs to get it all out. Think of it like brushing and flossing your teeth. You don't wait for the cavities to happen before you start brushing and flossing. You really need to do that daily, twice daily maintenance of brushing and flossing, and that's like adding the huff into the airway clearance. Exercise is a very important piece of the puzzle in taking care of you and your child with CF. Exercise can function as airway clearance. It may get things loosened up, especially if you're doing higher impact running or jumping type activities. However, it shouldn't replace airway clearance. You still need to be making sure you're getting all of those small airways cleaned out with the airway clearance. However, if you are exercising and you're tending to bring up some mucus, don't be afraid to add that huff in to help to clear a little bit more out so you get more mucus out with each cough that you do. Sometimes it's difficult to stick to your airway clearance routine, and we understand that. You may have a really busy day with school and work. The day starts very early for a lot of school kids, and it's hard to get everything done in the morning. Or maybe you're just wiped out, you're bringing up more mucus, and you're just not feeling up to coughing more often. You still should try and get that airway clearance in, and that's a time when maybe you can change things up a little bit. If you're used to sitting down for doing your therapies and doing your vest and everything is in position at home, but you happen to oversleep in the morning and don't have time, you need to have a plan B in place so that you can do something, a different breathing exercise or the a cappella more on the go, maybe on your way to school or work. Maybe you're feeling sick and not up to doing the regular treatment that you do. That's a time where you can change things up a little bit and do something like active cycle of breathing, which is just breathing exercises. You're alternating between normal breathing and deep breathing and adding in that huffing every so often, of course. Active cycle of breathing can be done when you're lying down. If you lie on your side while you're doing active cycle of breathing, that can help to open up the lungs in a different position that you're used to, and you may find that you clear more stuff out while still being in a rested position. The point of airway clearance is to clear the mucus out of your lungs. However, sometimes there's just so much mucus in there that people end up coughing throughout the whole session, and they are absolutely exhausted at the end. Airway clearance is designed to make you feel better, not feel worse. So if you or your child is someone that just coughs throughout and they are wiped out at the end of the session, it's time to talk to your physical therapist in clinic. By controlling the cough, learning how to control it, and there are different techniques to lessen the cough during the treatment, and using the huff, you really maximize on the effectiveness and the efficiency of the therapy. You let the vest or the a cappella or the breathing exercises do the work of loosening the mucus. The huff moves it up. The cough is designed just to get it out. So if you're coughing throughout the session, we need to talk and figure out maybe there's a different technique that's better for you that will be a little bit easier and less exhausting, or maybe it's just working through and learning how to control the cough a little bit better. A question that comes up often from parents or from patients themselves is, what is the best airway clearance technique? You know what? There isn't an answer to that. It's a matter of figuring out through trial and error what works best for you. Of course, there are always new devices coming out on the market, and patients will ask about them or families ask about them. Not everything has been shown to be effective in CF, so there are some devices that are better than others. However, we need to figure out which of those research-based devices are going to work best for you. It may be one thing in the morning and something else in the evening. It may be one thing when you feel sick and another thing when you're feeling really good. The most important thing is that through trial and error, we figure out what's going to work best for each individual patient. And finally, having the same airway clearance routine day in and day out can get boring. So let's mix it up a little bit and have some fun. For the kids out there, have you tried Bubble Pep? By combining an empty gallon jug with some tubing and then adding some water, food coloring, and dish soap, you can create a fun pep therapy that's going to be exercise for the lungs and also fun for the child. Different blowing and breathing games using bubbles, toy instruments, things like that can really mix it up a little bit and incorporate more normal activities and still be therapeutic. For the adults or even for the children, tired of your routine? Maybe it's time to try something different. Maybe you'll find that something else works better for you than your current routine. So it's important to talk with your care team, talk with your physical therapist when you're in clinic, and see if there's something else out there. Again, always having that plan B or backup plan to switch things up can make it a little bit more interesting and also keep you on track if you miss a treatment for any reason.